Atrial fibrillation is an abnormal heart rhythm from the upper chambers of the heart, and this abnormal heart rhythm impacts patients in two ways fundamentally. It increases their risk of stroke and it increases their risk of heart failure, in addition to adversely impacting their quality of life. The diagnosis of atrial fibrillation, it can be incredibly difficult to make at times because the abnormal heart rhythm can be paroxysmal, which means it can come and go. So the patients may complain of symptoms, showed up, and have nothing wrong with them. Sort of like taking your car to the mechanic and you have a noise and it will show up for mechanic. So we are often, very often, having our patient wear monitors or undergoing procedures where we insert monitors under the skin to capture symptoms. But to make matters even trickier, sometimes the symptoms are from other heartbeats or other issues like blood pressure. And there's no abnormal heart rhythm there at that time. And that can make it even more elusive. So monitoring is the key. And I think that the types of monitors we use is really growing rapidly, and the types of monitors we have available in the future are pretty exciting. The management of this arrhythmia is very depending upon the patient's disease. We have a lot of therapy we can throw at. One therapy is medication. Another therapy is ablation. And within those two therapies, there are a multitude of different options. The other aspect of treatments is preventing stroke. And again, we have medications. We also have invasive therapies to prevent stroke. And the options, again, are multiple within those two broad areas of treatment. At Ohio State, we have, for cardiac arrhythmias, some of the broadest and deepest pools of competence in the regions and in the country. The types of therapies that we have developed and helped developed have been expanded to treat people with the toughest forms of atrial fibrillation, and we work hand in hand with our heart failure physicians and our surgeons. If the needs go beyond electrophysiology itself, I would say that we have within our group of physicians and electrophysiologists in Ohio State some of the greatest experience dealing with these arrhythmias as you can find anywhere.